Good morning, everyone. Thank you for being here early on a Thursday morning again. And I wanted to say welcome to our special guest, Mark Madden, who I see is here, Dr. Mark Madden. Thank you for being here. I'd like to start with a land acknowledgement and acknowledge that I am fortunate to live, work, and play on the unceded and traditional territories of the Musqueam, Tsleil-Waututh, and Squamish, for which I am thankful. And we're going to just breeze through a couple of really new and important updates. We've got the new form for urgent CT and ultrasound, and that'll be spoken to by Dr. Mark Madden. We also have the new referral form that we mentioned previously, but it's up and ready to go. And so we'll tell you about that for the emergency department. New physician peer support program that we have that we're excited about. And then everyone's favorite topic in the last while, the PAS. Just a couple of things to mention about ongoing maintenance. And then upcoming events. We've got some great upcoming events that I wanted to highlight for you. And Mark, if you're ready to go, we'll pass it over to you.
Great. Thanks, Candice. Thanks, everyone. Hopefully everyone can hear me. If I don't see any hands go up. It's great to see everyone and see a lot of familiar names on the board here. So I'm here to talk about a new initiative that we've come up with to help you guys essentially get quicker CT and ultrasound studies. So the background to this is Victoria has a program similar to this where GPs can refer patients for specific CT and ultrasounds on a same-day basis. So the urgent same-day CT and ultrasound access. And so here at Lionsgate, we've come up with a plan of how we can do that. And so this is what we're talking about today. We can go to the next slide. So essentially the image on your left is the guidelines, the sort of rule book behind this. And then the sheet on the right is what you're actually going to be filling out in addition to a normal requisition. So there is a lot of stuff on here, so I'll try and go fairly quickly, but you can read through at your leisure. This is currently on Pathways. So as it says at the top, it's designed to allow you access to same-day CT or ultrasound imaging, which would otherwise necessitate a same-day emergency visit. It's not meant to, of course, replace an emerge visit that otherwise the patient would be going for. So really, it's like the question you should ask yourself is, okay, if I could get that CTPE and have it negative, then I don't need to send them to emerge. And that's what this program is made for. So the access hours are Monday to Friday for now, 0800 to 1600. You need to give us an easy number to contact you directly. So that's a very important part, is not a front office number. It needs to be either your cell phone or a direct office line where you're sitting and working. We're not currently accepting back pains or malignant workups in this program. We'll need a GFR within 3 months. The table below that is what scans we're letting through right now. So non-con heads, CTPEs, CT abdopels, and then arm and leg Doppler and ultrasound of the pelvis for rule-out ectopic. This is the flow pathway below that as to what we sort of expect would happen. You're going to fill in this referral form here on the right. Once you've decided that you need imaging. There are a few ultrasound specific rules. CT is a little different than ultrasound in that CT we can usually squeeze in at a short notice, whereas ultrasound often needs a prep. There's obviously a technologist on the other side who takes 30 to 45 minutes to scan you. So we ask that you actually call in for that one and make sure there's actually a spot and get any preparation instructions given before you send the patient. Whereas CT, you would just fill in the form and send the patient to the emergency. And so all these rules are spelled out here. On the right side is the actual fill-in form. So you're going to fill in their name, check a few boxes that just shows that you've read and understand some of the rules, that you've given us a GFR, what scan you're actually looking for. And then very importantly, the results section here is what do we do with the patient once the scan's been done? So what will happen is the scan will get completed. The radiologist will report it. And then would you like us to send them home? Do you want us to send them back to you? If it's positive, if it's negative, all of those things. And then your contact number. So we're really hoping this helps deal with, those odd cases where you're otherwise are sending the patient to the emergency department. This is obviously a new initiative. We want you to make sure that it works for you. So any feedback can be directed back at me. Dean Brown is also on the same committee, so he would accept feedback as well. So we're looking to make this work for all of us, really. And that's about all I wanted to mention.
Fantastic, thank you. And this will be on Pathways, and so will the next form, and we'll mention that at the end. But they'll also be in the newsletter with links, so they'll be out to you in a couple of ways for you to access. Thank you so much for coming to mention that. And if there are further questions anyone has, I can always forward them to you and to Dean and the group.
Thanks, Candice. And just one more thing to mention to the docs, this is live today, so you could start using this as of now.
Fantastic. I see there's a question in there.
Oh, I do see a question. What if the patient needs CT urgently and does not have creatinine available for less than 3 months? Often the lab at Lionsgate will do same day creatinine and GFR, so it's not a definite no. You know, if it was 3 months in one day, we might allow that. If it's 6 or 9 months old, they probably need to get that updated GFR first.
Great. Thank you very much. Okay. Process for new ED referrals. So we mentioned this last rapid fire, I believe, but now we have the form on Pathways. So you can send a standard referral letter from your EMR if you'd like to, as long as it's got the information that is required for the emergency department referral. Or you can send a note to Emerge, and that is through a form on Pathways. And instruct the patient to give the form directly to the ED physician. So you can print out a copy or a virtual copy is fine. Make sure the patient has it in hand when they show up to the emergency department, and then want to make sure that they're giving it directly to the ED physician, so that we ensure that the communication from our family physicians is getting straight to the ED physician as well. Dean, did you want to add anything to that?
No, I think that's one of the key factors is to give it directly to the Emerge physician so that it doesn't get snagged by the staff at the front or somehow get lost in the process along the way. So it's important to flag that to the patient, say, please give this to the emergency doctor when you do finally see them.
Great, thank you. And so this is the form, and this is the one that's on Pathways. So it gives you a little quick view of what information is on there. It's very easy and basic to fill out. Okay, and let's see. Next thing we wanted to mention. North Shore Physician Peer Support Program. Just looking at the chat, sorry. Yeah. Thanks for taking care of that, Dean. So the new peer support program, there's a lot of information on the website, so we're just giving you a snapshot here. You can also just use your phone right now for the QR code. But this program, it offers brief non-clinical support to physicians dealing with work or life-related stressors through trained physician peer supports. They offer non-judgmental listening and non-clinic emotional support with life, work, and other issues. They aim to facilitate these confidential, non-clinical, empathetic conversations between colleagues where physicians feel safe to share issues that they're experiencing with someone trained in the program. And so definitely for more information, you can look on our website. It's already there. And I'm excited to hear more about this in the coming days and months. And let's see. Annual re-enrollment, there still are some questions about who's supposed to be billing what codes. So just a reminder that all LFP physicians and LFP locums need to rebuild the code annually between January and March. So you still have time. And then the portal code 14070, I've got a couple of questions about that. That is to be billed as well, and that's for the non-LFP type billings that might be outside of the LFP stuff. So make sure that if you qualify, you're billing that as well. And some PAS stuff. So we knew the deadline was yesterday, and certainly Mary Lou has been working overtime, and Kelsey as well, to make sure that we got everyone we possibly could hear about who still needed to do it by the end of yesterday. And so we've now got the registration. The clinic is registered, the physicians are attached to the clinics, and the clinics are all registered, and patients are all listed there. We are hearing that people might not think the patient panel that has been uploaded is incredibly accurate. Also, people are still accepting patients, so they're wondering how they go ahead and add to that list they might have submitted a few months ago. So for each patient that is newly attached to you, you can build the attachment code 98990. And if you have a chunk of them, like perhaps you've got 50 patients that you have attached, then as long as you can identify who those 50 are, you can go ahead and send in that billing. And then they will be added to the PAS automatically through that billing code. Right now, to remove a patient, you have to go into the PAS directly and individually remove them. It is easy, but you do have to go into the PAS to do it. And in the future, we've heard a rumor that there will be a new billing code potentially that you can bill just to remove a patient. So as you're working through your day and you find someone's sent a chart transfer, or they're telling you that they've moved, then hopefully you'll be able to just bill the billing code that unattaches patients. And so we'll provide you more information on that as it becomes concrete. You'll also notice there's a new box there when you go into the PAS that says confirmed panel capacity. So I wanted to get ahead of this a little bit and let people know that I'm sure that there's some maintenance required throughout the year. And so heads up that they may give a timeline, like every 6 months, you'll have to go in and check confirmed panel capacity, which will add a date automatically as to when you've confirmed it. When we hear any concrete instructions around that, we will certainly let you know as well. We'll bring all information to you as soon as possible, but just know that that's probably something that's coming up. And if your MOAs have been authorized to go in there and do data maintenance for you, then the MOA can certainly take that task on. Mary Lou, did you want to add anything about the PAS before we move forward?
Yes, I just added it on the chat. There's also, for clinic directors, there's also a new box that says confirm clinic details. So just make sure that you click on that as well. Otherwise, they will start sending emails, right? If you don't get an email, I think it's good news. If you're getting any emails, that means you have to go into the PAS.
Yes, so some of you will have gotten an email in the last 2 weeks saying you didn't do something, but they're not altogether clear on what you didn't do. If that's the case and you need some help troubleshooting that, let Mary Lou know, because she's getting very familiar with the little bits that were missed or the processes that are unclear. So you can certainly let Mary Lou know. However, she will be away next week, deservedly so. It's been a big couple of weeks for Mary Lou, but if you do have any questions, our team is always here. You can let us know. And just a reminder that we've got the Health Connect registry. That's a provincial system now. So for those of you who may still have some GP Link cards or posters in your office, the GP Link website will redirect people to HealthLink BC to register if they're looking for a family physician. And so when we get any sort of handouts or brochures from them, we will certainly distribute them to the clinics that are interested in having them on hand. But for everyone in the province, they can direct their patients to the Health Connect registry to register and get on that wait list for a family physician. Of note, I can't remember what the amount is, but it's been over 500 a month at least that we've been attaching to our service providers on the North Shore. So our attachment coordinator has been crazy busy working on attachments. We've got more physicians accepting patients on the North Shore than we have in a very long time. So that wait list is coming down. So that's really good news. On to events. We have a Dine and Learn, the Serious Illness Conversations workshop, and that is Wednesday, February 27th in person. And just to give the physicians a heads up, we've got an MOA Lunch and Learn 2 Sundays from now, February 11th where we will be doing naloxone training and a little bit of workflow stuff around scheduling and whatnot in order to prep for a physician meeting that we have coming up. Our next rapid fire, as always, is the Thursday. Well, not always, there's been an exception, but every Thursday, every first Thursday of the month. So the next one is March 7th. And then I wanted to take a moment to talk about an event that we're about to launch. So you should see an invitation for this in the next day or two. Practice management workshop. So save the date. It'll be in the evening at the Pinnacle Hotel. And it's going to feel very much like a rapid fire, but in person with some templates and worksheets to work on. And there's going to be a lot of topics that we're going to try and cover. So we know that the new HPV screening came out, but how does that workflow happen in your EMR and in the office? And a lot of our clinics have a PAP reminder or recall or follow-up in our EMRs, and what are we doing with those? And we are looking at creating a template that physicians could mass email out to their patients to give them a heads up about this new process, where they can contact and get their own kit if they'd prefer, that they still can come in for a PAP. Certainly what the requirements are, because I think they're starting out with specific requirements, but all of that will have an impact to the workflow in the EMR, particularly the reminders and the calls that we make. We're going to talk about issues around online booking and high volume of emails, high volume of phone calls, and if there's anything we can do about that. My personal large focus is about same-day access and better schedules. So doing a little bit, or having your MOAs do a little bit of measure collecting on your wait times and how many patients generally call and need to be squeezed in that day, so we can better prepare for them. So we've got some tips and tricks around how to address that. Very practical tips. We would like to talk a little bit, we'd start talking about AI for chart noting, as that's becoming something that's come up. HR resources for MOAs, and talking about, we did a physician survey and we did an MOA survey, and there's quite a variance in what the responses were. So we're going to talk about that in the HR piece for MOAs. We'd also like to hear from physicians with the new set of tasks that a pharmacist can take on, such as an emergency refill of some kind, but also the list says UTIs and a bunch of other things. We'd like to hear how our physicians feel about our MOAs, deferring people over to community pharmacists if it's necessary, and create a little bit of a workflow. So we'll have a worksheet for that. Talk quickly about the re-referral process, all sorts of stuff. So we're going to try and pack in a lot of stuff that's relevant to what's happening today in our offices, and do it in a pretty quick fashion with a little bit of workshopy stuff. So by the time you leave, you've probably made some decisions. We're then going to follow up with a series of MOA webinars so that we can support them in any, to implement any changes that physicians have decided they'd like to go ahead and try with. So that'll be March 6th in the evening at the Pinnacle. And so, yeah, if you have any feedback about what else you'd like us to speak to at that March 6th event, please do let me know. The agenda's in the works, so you still have time to let us know your feedback, and we hear you, and we want to address all sorts of little things in a big packed agenda, so we can get a lot done in a small amount of time. So thank you so much for coming this morning. Nice, quick and short one, like we try to always do. Any other comments or questions, please put them in chat or raise your hand. Otherwise, we're good to go. That was all the content, and I really appreciate that folks are showing up so early in the morning before their day. And thank you to Dr. Mark Madden for coming to let us know about this new process. I'm excited to hear about it. So thanks, everyone. Have a good day.